If you or a loved one has cancer but feel lost, and you don't understand the diagnosis, the treatment options, the side effects of treatment, or have other questions on your mind, then Online Oncology is the best place to find the right answers. Through a series of videos, we will help you every step of the way. Now let's get started with today's topic.
Welcome everybody to today's episode of Be Smart, Fight Strong. This is your Dr. Riaz with another episode, and today our topic is basic facts you need to know about your cancer. Number one, you need to know the exact type of your cancer. If you have lung cancer, that's not enough. There are 4 types of lung cancer, and you need to know the exact type that you have. And it has a lot of implication as to how you're going to be treated, because not all the 4 types are treated the same way. The prognosis is not the same in all those 4 types. Hence, it is very important for you to know the exact type of your cancer. Number 2, what are the detailed features of your cancer? For example, the 2 women, so to speak, may have breast cancer, but one woman may have estrogen receptor negative, progesterone receptor negative, and HER2/neu negative, and the other women may have everything positive. Their cancers are not the same. They are entirely different diseases. Their course is different, their treatment's going to be different, their prognosis is going to be different. That's why it's very important to know the detailed features of each type of cancer. Number 3, you need to know the exact stage of your cancer. Either it's stage 1, 2, 3, or 4. For majority of the cancer, especially that comes from our organs, there are 4 stages of the cancer, and you need to know the exact stage. Again, the prognosis of each stage is different. The treatment of each stage is different. That's why it is a very critical piece of information that you need to know. Number 4, you need to know your pathology report word by word. Now, what I mean by that, every case of cancer has biopsies done, and those biopsy specimens are submitted to the pathologist for review. They look at those specimens under the microscope, they stain them, they process them, they do other molecular testing and genetic testing on them, and that's how they give the medical oncologist a report. And it is an official report which is generated. It is your duty to have a copy of that report and know what that report says, because that has all the information. For example, what kind of cancer you have, what is the behavior of the cancer. Usually they will determine the behavior based on what is the grade of the cancer. Grade 1 are the slow growing type of cancer. Grade 3 and 4 are the fast growing type of cancer. Then is it a well differentiated, which is a slow kind, or is it a poorly differentiated, which is an aggressive kind of cancer? Based on the staining, are there any receptors on the cancer? All of this information is present on the pathology report, and you need to know your pathology report very well. Number 5, what are all the places where you have cancer? This is a very important piece of information, and you can get that information from all the imaging studies that are done on you. So the CT scan reports, MRI reports, bone scans, X-rays, all of them will give you that piece of information. Hence, a review of those reports by yourself, in addition to your doctor, obviously, is very important. That's why you need to know all the places where the cancer is important, because these are all the places you will be tracking along the course of your cancer treatment, that if your treatment is working or not, and if the cancer is shrinking at all the places or not. Hence, this is very important. And a good practice will be that you have copies of all the reports from all those imaging studies. Number 6, you need to know for a fact what are all the medicines that you have taken for your cancer. You need to know all the medicines, period, but most importantly, all the cancer treatment medicines. If you are on chemotherapy, then what is the name of that chemotherapy medicine, or how many you got. Some people get 2, some people get 3, some people can get 1. So you need to know when did you get any medicine. So you need to, in a chronological order, you need to write them down, and you should know them for a fact, all the medicines you have taken during your journey. Sometimes it's not chemo, it's immunotherapy. Again, those immunotherapies are of different kind and they have specific names, and you need to know those medicines by their names. Now there is a new class of medicine called targeted therapy. Majority of these targeted therapies are pills, and again, they have specific names. You need to know those names. Long story short, you need to know all the medicines that have been given to you for the treatment of your cancer. Not only that, but other medicines you are taking for other medical problems like heart problem, diabetes, blood pressure. You need to have a record of all those too. And this is information you should be carrying that to your doctor's office at each visit. Next, you need to know what is the role of each member of your cancer care team. I'm sure you know the role of the doctor, but the nurses at the cancer center also have specific roles. There are some nurses that work directly with the doctors. There are some nurses who only administer chemotherapy. Some of the staff member only take your vitals, and you need to know what is the role of each member. Some other members of the cancer care team are navigators. Patient navigators are actually very important person, because that person is your first point of contact, and you can call them with any problem during the cancer treatment. Hence, navigators have a huge role to play in coordinating the overall care of the patient between different doctors, nurses, and different specialties. They can also help you organize your treatment, schedule your imaging studies, and they can help you a lot, and they can guide you a lot. If you have any problems with your medicines, they can help you or give you the advice as to what to do if you encounter a certain side effect. There are social workers present in almost all major cancer centers, and these social workers are very important to get financial aspect of the care in order. They will work with your insurance company to get certain medicines, certain scans approved, and they can also help you arrange certain, like for example, you need a equipment, a walker. They will help you arrange that, and they will guide you from where to get it. They can save you a lot of money during the course of your treatment. Number 9, you need to know for a fact that the treatments you are getting, how effective they are on your cancer. Usually what happens is that when a certain treatment is started, there is a certain expectation that it's going to work in a month or 2 months or 3 months. Sometimes doctors tell them that we're going to do 2 cycles or 3 cycles. So you need to know for a fact that what is the expectation from that medicine. What is the response rate of that medicine working in your particular situation, and after how much time the doctor is gonna reevaluate by doing CT scans or MRIs to know the response of the treatment. Number 10, the treatments you are taking most definitely gonna have some sort of side effect, and you need to know what those side effects will be. Usually at the beginning of each treatment, patients have a session with their doctor and other nurses called chemo education class. And in this class, the nurse or the doctor answer their questions. They tell them the common side effects, and they also give them written material. It's your responsibility to go through that material and know all the potential side effects that the chemo can cause. Now, you may read a lot of things, but not everything has to happen in everybody, but at least be mindful of all the possibilities that can happen, because if you know that certain problem can happen, you will take a proactive approach, and at the first sign of that problem, you can start taking action to counter that problem. And starting a medicine or any other intervention to counter the side effect of a particular medicine can help you a lot in preventing major consequences from that side effect. because some of these consequences can be really bad. You can get really bad infections. You may end up being in a hospitals, and in the extreme case scenario, people can die from those side effects. Number 11, you should know what are all the clinical trials available in your area or elsewhere where you can easily travel that are pertinent to your situation. A lot of people who are dealing with stage 4 cancer will come to a point where they will no longer have any good treatment left. Either they have used all the treatments, or some of the treatments are not working, or they are not eligible to get some of the treatment because the side effects are just too bad. In these situations, the clinical trials help a lot. Hence, it will be a very good idea that from time to time you visit the resources which tells you about clinical trial in your area. A good resource is clinicaltrial.gov, which is a government website where you can put in some information about your cancer, and it will give you a list of options, and then you can narrow it down based on your city or state. It's a very critical piece of information that you should have. Remember, knowledge is power, and the more power you have, the better you can coordinate your care between your providers, and the better outcomes you can have. You will be proactive in your approach to counter any problems that may come along, and you will be more engaged and more involved in your care. That can make a huge difference in the ultimate outcome from cancer.
We hope you find this video helpful. The more knowledge you have and the more informed you are about your condition, the better decisions you can make about your health. Please spread the message to other people that may also benefit from this knowledge. We have covered several topics about cancer care in other videos. To learn more about these, visit our website, www.onlineoncology.com. You can also visit our Facebook page, YouTube channel, Instagram, and follow us on Twitter on onlineoncology.com. Be smart, fight strong.